I'd just like to take a minute of our day to talk to you about a patient who's just come into the clinic. She's a 40-year-old female, normally healthy. Her chief complaint is upper right quadrant pain, radiating up into the back. She used her usual good health until 4 days prior to coming in. She has no pertinent medical or surgical history to explain her symptoms. Her abdominal pain started 4 days ago after eating a bunch of high fat foods at a family buffet restaurant. She reports that the pain was isolated to the upper right quadrant until about 24 hours ago when it began to fill the epigastric area and radiate up into the bilateral scapula. She does report this pain is constant. She used the words dull and gnawing when asked to describe. She states that it does have periods of intensifying when it becomes more of a sharp or burning pain. She rates her overall discomfort as a 4 on 10, with periods of it intensifying to 8 on 10. Normally, this is happening every hour and a half and lasts about 20 minutes. She did report that she's having some nausea and 2 episodes of vomiting within the last 24 hours, seemingly getting worse as the days are going on. She states that she does have momentarily relieved symptoms when she's lying in a curled position or hunched over, but the symptoms do quickly return. She did try taking some over the counter medications to help deal with this. She tried Tylenol, Advil, as well as naproxen. She then tried, by recommendation of her pharmacist, Buscapam, which did minimally relieve her symptoms. Unfortunately, it was very fleeting. When asked if anything makes it worse, she did say that eating does make it worse, with about 20 minutes after eating being the most intense pain. She did say that she had the same events happen to her before twice, once 3 months ago before a big exam, and once 1 month ago with no relatable event. She also noted that her mom had a laparoscopic cholecystectomy when she was in her 30s. So other than the her mother's family history of having the gallbladder removed, there's been no gastrointestinal disease or disorder in her family. She hasn't had any recent falls or injury herself to the abdomen. She does report having a normal menstrual cycle that actually she did do a beta within the last 2 weeks, urine pregnancy test, and it was negative. She doesn't have a family history or personal history with liver dysfunction or disease, and she hasn't had any surgical procedures at all to note, none to the abdomen. She reports that there's been no dietary changes or experimentation in the last couple of weeks, and she hasn't traveled outside of the country within the last couple of weeks. She did report that she was seen by an emergency physician with the initial episode 3 months ago. She did not have any blood work done. She did not have any ultrasound or DI done. She reported that they gave her pain medication and informed her it was likely a muscle tear. She did report that 12 hours after leaving the emergency department, her symptoms seemed to resolve, so she did not follow up. NM is not taking any prescribed medications daily. She does take a multivitamin and she does take supplements for vitamin D. She does have a known allergy for moxifloxacin. She has no pertinent medical or surgical history, like I said, that's going to lead to an etiology for what's causing her abdominal pain episodes now. She does live on her own independently. She's very well adjusted. She works full time as a registered nurse. She's also doing school part time. She denies drugs or alcohol intake at all, and she seems to have a very good relationship with her family and her friends. On physical exam, I noted that she's vitally stable. She's afebrile. She does appear uncomfortable. She appears to be in pain, but no diaphoresis. She Her abdomen is of good color. It's protuberant. I did auscultate good, loud, regular bowel sounds in each of the 4 quadrants. I did not hear any concerning bruits. I did palpate her abdomen. It's soft. It is marked with tenderness to the upper right quadrant and the epigastric area. I was able to palpate her liver, which was smooth and about 4 centimeters, palpable about 1.5 centimeters below the right costal margin. I was not able to palpate her spleen or her kidneys, and she did not have any costal vertebral angle tenderness, but she does have a positive Murphy sign on exam. So again, she's 40 years old. She's healthy. She's presenting with upper right quadrant and epigastric pain that seems to be getting worse over the last 4 days now with vomiting. She does appear well, but she's having marked tenderness on palpation to the upper right quadrant and epigastrum area, as well as a positive Murphy sign.